So, good evening, everyone. Today, we are continuing with our podcast series, and today we have this opportunity to have with us one of my friend, one of my colleagues, one of my very close friend who has appeared the exam along with me in the January 2024, and we have both passed the exam on the same day. Today, we have with us Dr. Darshan. He's a consultant urologist who is practicing in Iraq currently, and he's a fellow in transplant as well. So we have a lot of questions regarding transplant and its importance in the FRCS exam. Are there a lot of questions asked? How much important it is? Do we need to study a lot? If at all we have to study, which are the parts we have to study and from where we should study? I think we have the best person to answer these queries. Thank you, Dr. Darshit, for taking out time for us. And
You're welcome. Thank you. Thank you.
so please, before we take up the questions that related to the transplant, could you please introduce about your FRCS journey? Because that is what we are always trying to hear from everyone, every person who has gone through this FRCS exam. We want to hear from them. How was it? How was your experience?
My FRS journey, and not good, not bad. A little bit bad because too much duration, and I participate. I submit the application 2018. Then my first section on 2019 in Dubai.
Okay.
I passed in the first trial with a high degree, 84 about.
Okay.
Then COVID came in, 2 to 3 years, there is no exam. At the 23, I did a section 2 in Malta. Unfortunately, I didn't pass, something my fault. It's the first time in my life failed in exam since childhood. Then the second trial in Dubai with Dr. Ankit, thank God, we are all both passed it.
Yeah. So can you please tell us more about like, see, pass and fail doesn't matter, which I have always been focusing on because this is a very challenging exam. So
Yes.
what are the challenges you faced and which are the areas you faced really difficult and which are the areas you would recommend candidates to actually stress upon more? Which areas do you think is the most challenging one?
For every candidate should study for passing the exam. The exam differ from your location experience, your country, because you are international, not working in UK.
Yeah.
Some different system. Regarding the section 1, we can read everything, FRCS books, Campbell, some extra and guidelines. Section 1, I don't think too much difficult because mostly basic.
Right.
You can read from every book. I personally read FRCS questions,
Okay.
MSQ, and Campbell, all Campbell,
Okay.
and some extra from internet.
Yeah. So you said Campbell. I think many of us don't want to read Campbell, but what I believe is most of us during our training we have been reading Campbell. So if you have a base from Campbell, reading any other book becomes easy. So
Yes,
it's always good.
personally, I read Campbell and since starting urology too
Yeah.
much.
Right.
I think the best book for urologists.
Right. Right. And what about your section two? What would you recommend, and how was your section two experience?
I will tell you my fault is in section 2. Section 2, better to every candidate to look more videos, participate in courses, read the FRCS books, and exam as FRCS. Because we are participating in our country exam, and even I'm an examiner for candidates in our country,
Right.
differ system. Because in FRCS, something else. You have to know about the approach, how to talk, because something tricky, not everything knowledge.
Right.
Something tricky, how to talk, how to approach to the patient, information about chemotherapy, radiotherapy, something system in the UK about something error, reporting error, how to deal with the mistakes, medical mistakes.
Right. So
These are different from
it's
country to
different
country.
from approach is different from what is in our country.
Yes,
The approach is totally different. So we should be preparing in that manner only. And sooner we realize, the better it is, we can save time.
yes. At least it is a time management in section 2. Time
Right.
management is crucial for every candidate. a small group, as we did, me and Dr. Anki and other colleagues, small groups for studying. Then before the exam, we changed to one time. I'm examiner, Dr. Anki a candidate. Then Dr. Anki became examiner, and I was a candidate every 10 minutes. Make you more trained about the time management.
Right. We should be having a timer with us whenever you are preparing. It should feel like you are actually on your exam day. Every practice session should make you feel like an exam experience. So, if we take up the questions that we are commonly asked regarding transplant, what do you think? How much time should we read transplant? Is it important for section one? And what about section two?
Really, I don't think transplant too much important in the FRCS because يعني I don't hear from my colleagues too much question about the transplant. But if you know that's the basic of the transplant, indication of renal replacement therapy, and what is the renal replacement therapy? Dialysis, peritoneal, hemodialysis, hemofiltration, and transplantation. What about the donor? Which side, left and right? Procedure. Anastomosis of the renal artery to iliac artery, iliac vein, and ureteroneostomy. Some
Right,
complication of transplant regarding rejection.
right.
The surgical complication nearly same. Bleeding, infection, hematoma, wound infection, stricture, like general surgery a little bit.
So they mainly ask on the complications, even that we have been hearing that mainly we should be very clear about the complications of the transplant and the drugs related to the transplant. There are questions on the drugs as well. So for the,
Yes,
but
about immunosuppressant drug is the transplant should do it by a team, by a nephrologist, transplant surgeon, cardiologist, radiologist, psychologist, in assessment, peri-operative. There's a committee.
right, right, right. And is it really important for section two? Can a candidate leave transplant and go for section two?
I think if asking you something about the surgical, for example, one of our colleague, they ask at which side transplant, right side, left side, why right side, how you anastomosis, to which vessel, to which vessel, something simple and basic.
Yeah, yeah. So the basic, if you're clear with the basic, I think you don't have to go into too much detail for a transplant. You can
Mm.
stick to the basics regarding the anastomosis and what are the indications and when you should not do a transplant. What are the
Yes. What are the types of donor? This is a donor and living donor. This is a brain death and heart cardiac death donor. Why mostly left side? Because longer vein. Left donor kidney for the right iliac fossa. Why right iliac fossa is
right?
the preferred approach? Because the iliac vessels more shallower and straighter in compared to the left side.
Yeah, I think anybody
Yes.
who has prepared a transplant, who has assisted or performed a transplant, it's very easy for them to tackle
Yes. Yes.
scenarios on transplant. It's not so complicated, unlike the rest
No.
of
No.
biology, like oncology or any other part. So, which might be more complicated. Transplant is a bit easier if you get in your section, and usually.
Because transplant really it's somebody different from urology. In some country, general surgeon become a transplant surgeon.
So, what do you think is the most complicated part of this Viva? Which station do you think is very complicated
For
and
me personally, urotechnology and functional urology.
functional is not for you. Functional is for everyone. I think most of the urologists are not practicing functional. I think it's very difficult. So can you share what are the areas which you find which one should pay more attention to in the functional? How complicated these are?
One scenario in my case in the Malta, they say to me from the ward of the orthopedic, they call you. There is a case for about 12 hours, no urination. When you palpate abdomen distend, a lady,
Right,
how they consult you, what you will do? I said I will see the patient. I start history and focus examination, distended bladder. I will insert a folic acid. He
right,
said, what else? What else? I said later on re-evaluation. What is
right,
the most common cause? And the patient, sorry, I forget, severe backache and ready to lower.
right,
I told him this is a neurological cause, sciatica. He said, what else? He said, why you are not ordering MRI? I told him, in our system, The MRI, ordinary MRI, should be by the spine physician or surgeon. But in the exam, he said you should order some bit different from our system.
Exactly,
He
exactly.
he said you missed something.
So I think even it depends on the examiner how they're leading you. I think sometimes the
Yes,
examiner has to be considerate and lead you, try to understand that okay, this is not a gross problem. Let us take the candidate ahead to the next question. And sometimes the examiners they stick to that question, and just the time goes on, and there is a lot of loss of confidence. You start losing confidence if you don't answer two, three question, or if the examiner sits on that question for a long time.
some examiner يعني teasing you to make you angry. He
Right.
said, and I told him I'm as a urologist only instead of forecast that later on, if not recover, maybe require urodynamic something else, mostly lower motor neuron lesion, atonic bladder, CIC. He said, what about MI? For the spine, emergency surgery for the spine. At which time? I told him, give analgesia and steroid and ask the neurosurgeon to do surgery as soon as possible. But he make me too much question about the spine. I'm not a spine surgeon.
So, this is, I think, a bit of luck also, what the examiners you are facing. And sometimes it's not very easy to understand what the examiners actually want from you. And those 1 minute, 2 minute can cost you a lot of marks.
Yeah, I suggested from after Malta, I sent an email. I suggest to the case scenario better to read it in the paper ourselves and reading because sometimes the examiner read for you. You may problem from the understanding some language, or sometimes you miss it because you forget. But if in a paper in front of you, you don't miss something. For example, one case, very obese, and BMI more than 40. In another in Malta, I told him I will instead of folic nephrostomy. He said for such obese, I said, oh, sorry, I forget obese. DJ instead, DJ stent.
Right.
Because I forget reading from the beginning.
Important point. Write down the things, whatever information is being provided.
Yes, there should be right age, male, female, obesity, comorbid, something right.
Right, very important. So, what we can conclude is basically if somebody has to read transplant, stick to the very basics and read about the drugs, read about the common complications, the common steps in the transplant, the donor and the recipient. And for your section,
And
if you are,
yes, and something about the histocompatibility regarding between donor and
yeah,
recipient.
rejections as well.
Yes, immunological workup.
Yeah, yeah, yeah. So that could be asked. And so these, you should not totally neglect transplant. You should not totally leave out transplant. At least it's basic better to have some idea on transplant before you.
Yes, at least some idea from the basic.
Right, right, right. Definitely. So if you, Dr. Dalshed, thank you for all the things that you said. It's important for all the candidates who will write the theory, write the appear for the section two. What would you be
Thank
your
you.
suggestion? What would be your suggestion for them? There is a
For the
section two exam.
last, my point, every candidate should be better relaxed. I know everyone has a stress. At the night before exam, sleep well. At the 10 p.m.,
Yeah,
better to go into bed and eating too much protein and a good diet and the early morning diet because hypoglycemia, stress, sleep deprivation make you affect your mood.
that's right, right,
In
right,
in Malta, I'm personally no much sleep and no much food. At the early morning, I feel headache,
right.
make me more and some bit angry in some. But while in second trial in Dubai at 10 p.m. I go to my bed eating too much, everything relaxed.
Right. Definitely. So, everybody, these are the last minute strategies that one should keep in mind. Even if you are prepared for 6 months and if on the day before exam, if you are not relaxed, then whole thing will be problem.
Yes, you lose the opportunity.
Yes. It's just a matter of 2.5 to 3 hours. It's a performance for 2.5 to 3 hours, right?
And 1 year you postpone your exam because every year one
It's
time exam.
once a year if you are appearing for international exam. For a UK exam, you can have twice in a year opportunity, but again, these are very less opportunities and very expensive opportunities. So we should try to be very calm, and we should make sure the preparation is all right, and not give too much importance to transplant, but not totally ignore it as well.
Yes.
So thank you so much. This is what we wanted to hear from you. I think you were the best person to talk about transplant in our group.
Thanks a lot. Thanks a lot.
A lot regarding transplant, all the transplant discussions. You have contributed a lot, and whenever there was a question on transplant, I would think about you that you are going to answer that.
Thanks a lot.
Thank you so much. Thank you so much, and all the best to all the candidates who are going to appear for the upcoming exam.
You are welcome, dear.
Thank you so much, Dr. Dashit, for your time.
Thanks.
Thank you. Thank you.
Thanks. Goodbye. Good night.
Good.